About 5 years ago, I began experiencing blisters all over my hands, my feet, my head. It actually affected my eye, and I temporarily lost vision in my right eye. And a colleague of his introduced us, and in this brief meeting, I had already been to 6 different doctors, specialists, dermatologists, infectious disease, and really didn't get an answer as to what was causing these blisters. And the treatment that I was given was heavy steroids and things like that. And I really didn't want to be on that medication. So, brief discussion with Dr. Miranda, and Dr. Miranda asked me, had anybody suggested that I give up wheat? And I said no. And he said, well, it sounds like you have an intolerance to it, and this could be leading to something called leaky gut, and this could be why you're having this reaction. So he suggested that I give it a try, and I said, for how long? A few days. He says, no, months. Like, how many months? And 3 or 6 months. So I thought, oh my God. And he said, well, I could be wrong, but he said, try it, see if it works. So I did. I tried it for about 6 months. I gave up all bread and pasta, and the blisters really diminished. And I then set up an appointment with Dr. Miranda. That would be the first time that I went to see him after he had already, just in this conversation that we had, made the suggestion, and it worked. And he was the only doctor to give me a suggestion that actually improved what was going on with me. So over time, this was approximately about 5 years ago, and over time, visiting with him, he sort of mentioned other issues that was going on. My A1C, my marker for diabetes, was on the rise, as well as my C-reactive protein. And so he had approaches to it. He had approaches to treating these things that didn't require medication or sort of the standard medication. And I didn't want to be on diabetic medication to begin with. And it led to suggestions of a diet change. And it's essentially, I started on a keto diet, or keto-ish, and this diet improved my A1C, where I was already presenting as a diabetic with a high A1C above 7. In a matter of months, it took some time. I think that with all the suggestions that he had given me, it took time and to be patient. It's one of the things that we discussed. But my A1C did drop from the diabetic range down to a normal range, which was down to about 4.5. So that was the second suggestion, and a life-changing suggestion that came from Dr. Miranda in terms of managing my health, my overall health. And of course, now I'm talking about, this is probably year 2 of seeing Dr. Miranda by this time, maybe year 3. And we started to manage some of these things without medication, again through diet and through these suggestions and some other supplements that were helping. And there's lab work that will support these things that I'm saying in terms of the level of diabetes that I had at the time and what it is currently, my C-reactive protein, sort of a marker of overall inflammation, and that we began to manage. And then when we started looking at what was left on the plate of how I was feeling in terms of my overall health, I had some chronic injuries. I had a car accident as a teenager with a severe back injury, chronic pain daily. And then I also had an injury in my 30s that I sustained on my wrist that was causing me daily pain. And so in discussing with Dr. Miranda, we tried different things. Obviously losing weight and decreasing overall inflammation improved these symptoms over time, over the months and years, but it wasn't exactly where I wanted it to be. I wanted it to be better and not necessarily average. And Dr. Miranda said, well, who wants to be average? And so that started on the next round of therapy for me, the third thing, which is an interesting path to hormone replacement therapy, because it wasn't for maybe traditional symptoms or reasons, but to improve my health span and to regain my ability to be active, to be able to utilize both hands and be able to sleep better at night and not wake up in the morning with pain in my back. And so I think it has been maybe almost 3 years of a gradual trying different modalities or methods of receiving testosterone and hormone replacement. I think we've almost tried them all to see what would sort of fit and work best. And and we monitored the levels based on the symptom relief that I was receiving. And so now I currently enjoy almost no pain in my wrist and the ability to be active. Another side benefit is the diet. It not only helped with the diabetes, the additional weight loss, so this benefit of weight loss, which wasn't really the goal, it was more of can we get these markers down. The side benefit from overall everything was a reduction in weight, and that also improved other aspects of the quality of life that I received. So in a roundabout way, just in a brief meeting with Dr. Miranda, he provided me with solutions to problems that no other doctor had. They were through natural means, which was good for me, and that was better because I didn't want to be on any diabetic medication. And it was a little different having a discussion with a gynecologist, which I have discussions with gynecologists in my professional life. But as a man, to go see a gynecologist for health issues that I was having was a little different. But Dr. Miranda is trained like other doctors. He's a medical doctor and internal medicine doctor, if you boil it down to the basic level. And I sort of got over that. And the results were that I saw improvement that I wasn't getting in other offices or other doctors that I was seeing. So that's what's led me here and to give this testimonial. And I would encourage people that are having any kind of issue, any other health issues, or if they're tired of being on medications for whatever reason they may have, that there's an alternative out there. I would categorize Dr. Miranda as a functional medicine doctor. I don't know if he would, but I would, certainly. And I don't think we have enough of those in the Valley. And rather than simply, you have a blood sugar problem and here, take some medication, it's good to see a doctor take a different approach and not just, you need to change your diet. And recommendations for diabetes through Standard American Diet and through other diabetic associations doesn't really work and doesn't help improve your diabetes. And so I think through the recommendations that he gives, whether you want to look deeply into it or not, it just works. And I think that's the key thing. And so I would encourage anybody to at least get a second opinion and see if he can help you also provide solutions and improve your overall health.